There's another big threat of the virus resurging, and it could come from the mounds of COVID bio-waste that's piling up. Mounds of discarded PPE kits, masks and gloves from hospitals are ending up in scrapyards across the country. What's more, this used medical waste is being resold and recycled, and it is women and children who are sifting through these hazardous materials. Nitin Jain and Mohammad Hizbullah from India Today's Special Investigation Team unveil the COVID Waste Bazaar.
कोई है जो इसको साफ कर सकता है यहाँ पर?
Mountains of contaminated waste, piles of used PPE kits, sacks of discarded COVID syringes, gloves and masks. All taken from some of the leading government and private hospitals. Women segregate this infected scrap almost every day. Their children seen on the same ground of pandemic trash. Waste products from people who were infected by the virus. Totally unsafe, totally risky, and flowing directly back into the market.
We are at the grey market of COVID hospital waste. Such junkyard of infectious scrap are located no remote area, but in the national capital region.
Along the Delhi-Ghaziabad border, at Bhopura, PPE kits are being dried under the hot summer sun. Workers and their operators explain the waste is prepared for resale in retail, wholesale and to local recycling factories.
सारी PPE किट है ना?
हाँ भी है, नीचे भी गिरा में है।
तो यार छटाई भी यहीं हो रही है?
ये सूख रहा है, सुखा के दे रहा है ये।
The manager of this yard identified himself as Bhandari. He confesses that the waste comes in from some of Delhi's leading hospitals, government hospitals included.
वैसे तुम्हारा माल कहाँ से आ रहा है?
हमारा तो भाई ये आरएमएल वगैरह से आ जाता है।
तो आप लोग किस तरफ छटाई करवा?
हमारे पास मोम जाने का काम है।
छटाई और दे किस तरह हो?
भाई मैंने आपको क्या बतलाया, हमारा काम है गाड़ी पे लोड कर, मुझे ड्राइवर आएगा वो बतलाएगा कहाँ जा रहा है, डैश में से जाता है।
When probed, this truck driver disclosed the destination. The COVID scrap was headed to a recycling factory at Loni in Ghaziabad.
वो तो है वो अभी
मैं आज लेके आता हूँ।
कहाँ?
लोनी।
अच्छा लोनी में
लोनी ले।
अच्छा तो लोनी में मिल को दे रहे हो? कौन सी वाली को?
एक ही तो है, गोल चक्कर के बाद, नहर के पास।
Individual buyers looking for cheap kits and syringes also procure them from here by the kilo.
इसमें सब तुम्हारा ही है? ये सारा तुम्हारा है? साफ है?
साफ है, साफ ही मिलेंगे तुम्हें।
सुनील भाई ये बताओ कितना माल दे दोगे आप?
मिल जाएगा आपको 400-500 किलो मिल सकता है।
400-500 किलो की किट दे दोगे?
हाँ मिल जाएंगे।
और ग्लूकोज की बॉटल और वो पाइप
ये भी 200-250 किलो हो जाती है।
तो वैसे कौन से हॉस्पिटल का आपके पास?
क्या है?
कौन सा वाला?
परपरगंज वाला, वैशाली वाला,
दोनों का है।
India has generated more than 200 tons of COVID medical waste per day during the pandemic. Delhi and UP rank among the states with the highest outputs. The Central Pollution Control Board has already recommended separate arrangements for handling, segregating and disposing of COVID biomedical waste at designated disposal facilities equipped with incinerators. The reasons are obvious. Given the devastation of COVID, there cannot be even the slightest risk.
PPE वगैरह वेस्ट होती है कूलर में होती है हमारी, वो जो है कपड़े की जो है।
आप क्या कहाँ से आ रहा है?
ये थोड़ा बताओ छोटे मोटे
और पीपीई किट बताओ साफ
पीपी की 10 जा रही है
10 हजार लेकिन मुझे साफ चाहिए
तो छट जाएगी उसमें से साफ करना सब खुले से लगे
हाँ बताओ
ये जो पीपी किट वगैरह हमारी ये कम से कम 10 रुपये तो है
हाँ बताओ
जैसे कि ये मैंने लिखा कि प्राइस जो हो गई बिल्कुल ये मेरा आज की डेट में 57 लाख
57 रुपये किलो अच्छा
सिरिंज है अलग हो जाती है डंडी अलग हो जाती है
हाँ
सिरिंज आ गई है मेरी 63।
But a lot of infectious refuse ends up in yards like these to be recycled back into the market. The scene is no different at this yard in Delhi's Shram Vihar. Women sort COVID waste with children around them. Poor, desperate workers risking COVID infections. And with no choice but to be part of the chain that could prove lethal later, the epidemic of greed thrives on chronic poverty and weak regulations in Delhi and its backyard. Who knows how much of this dangerous recycled waste has already flowed back into the hospital system? Has the damage already been done? With Nitin Jain and Mohammad Hizbullah, this is India Today's special investigation team.
You know, it's not just the purchase and resale of used medical waste, but the mismanagement of this waste could lead to infections spreading by stealth. Experts have warned that authorities should be careful with the handling of the mountains of COVID-generated bio-waste that's been piling up since the pandemic began. The massive vaccination drive has also led to a huge amount of biomedical waste burden piling up. Take a look at this report.
A powder keg of a potential third wave. The virus smoldering in heaps of medical waste undetected. Mismanagement of biomedical waste has always been a challenge in India. What's worse is that experts are now saying that given the pandemic, the problems associated with this poor management of medical waste is only now increasing. Experts are also saying that this is extremely dangerous and risky, and that this mismanagement of biomedical waste is going to be the reason behind a spike of COVID-19 cases in the country in days and weeks to come. The statistics tell the tale. According to the Central Pollution Control Board, COVID scrap accounts for 20% of India's biomedical waste during the pandemic. Environment watchdog Centre for Science and Environment says even this hefty scale of pandemic trash is heavily underreported. Its research points to the mismatch between the caseload gone up by 234% between the first and second waves and a mere 11% increase in COVID-19 biomedical waste.
A lot of our waste is being handled by the informal sector, right? And they are never found working with proper protective equipments, which is obviously for their own safety. There have been reports of open dumping of COVID-19 waste or biomedical waste related to COVID-19. There have been instances of burning of this waste. So all these three pointers combined pose a very huge risk.
The sources of this waste are innumerable.
The sources of waste generation got diverse, because earlier we used to receive biomedical waste only from healthcare facility, but now it was coming from households, from quarantine centers, from makeshift treatment facilities.
According to the CSE, only around 5,000 generators shared information about COVID trash on the designated app in May this year. That's when India accounted for almost half of the world's new cases. In November last year, as many as 1 lakh disclosed waste information though. With current capacity seen as highly inadequate to handle COVID medical waste, it's high time policy makers focus their attention on the piled up trash that may become a source of virus transmission if left untreated. With Nitin Jain in New Delhi, Sneha Mordani, India Today.
This is a nightmare scenario waiting to unfold. The prospect of this biomedical waste leading to a greater health hazard. This needs to be dealt with on an urgent and immediate basis. Joining me to talk about this India Today investigation at this moment, we've got Sunil Pandey, Director at the Center for Waste Management at TERI. We've got Dr. Lata Ghanshamnani, ophthalmologist, co-founder of the NGO R. Nisarg Foundation. Ateen Biswas is the Program Director for Solid Waste Management at the Center for Science and Environment. I want to go across to Sunil Pandey. First, this India Today investigation shows how you've got mounds of medical waste piling up. What's alarming and very scary is that it's being recycled and reused. And secondly, the prospect of this creating greater health hazards. Can you explain why you believe that this is an investigation that needs to be paid immediate heed to?
It is very critical, as you said, and actually, interestingly, if you see the biomedical waste rules notified in 2016 allowed for recycling and material recovery of certain kind of waste, provided they were not infected. With COVID, situation is different, and response needs to be different. And even COVID suspected waste, if it is not even 100% marked COVID waste, even COVID suspected waste has to be treated as COVID waste. And that is why, no recycling as per CBCB guidelines, also as per International Solid Waste Association, no recycling material recovery of COVID infected waste was permitted and is permitted till date. And it was recommended that all these wastes needs to be collected separately. Segregation happens, but even if it doesn't happen, should be taken to final incineration facility. So that is why, if such waste is going for recycling or reuse after cleaning, not good. So I'll stop here.
Okay, Ateen Biswas, what do you believe needs to be done? The fact that you've got all this waste piling up, being reused. I'm actually looking at the various sections of the Indian Penal Code under which charges can be leveled. So you've got section 420, which is cheating, 336, which is endangering the life and safety of others, 269, unlawfully or negligently doing any act which can create an infection or lead to the spread of disease which is dangerous to life, 270, which is an act likely to spread infection or any disease of life. This is not just a money-making racket. This is a criminal act and needs to be dealt with accordingly, Ateen.
Yeah, I completely agree with you. If what you have just shown is, this is definitely a reality. There is no denial because we have clear evidence, right? Now, before I get on to the actual subject, I also need to highlight a couple of issues. COVID-19 waste is definitely another form of biomedical waste. So we do have an institutional mechanism to manage our biomedical waste. But COVID definitely has made things worse. Now it is about our capacity to deal with a certain volume of waste as a threshold. Okay, as I speak, we have 198 registered common biomedical waste treatment facility, or you can say incineration facility, as Dr. Pandey referred, right? And they have a capacity to incinerate, means to burn them. Okay, because that's what the guidelines and the policies basically suggest. Now, the problem in COVID-19 biomedical waste, we definitely have reasons to believe that it is not just because of segregation. When we analyze the data, say from May 2020 until 10th May 2021, because we did an extensive research on this, right? So we found that during this period, a total of 45,000 tons of COVID biomedical waste generation was reported. Now, the reason I say reported is that the Central Pollution Control Board introduced a mobile app, and that mobile app was brought in effect on the 1st May of 2020. And an Honorable Supreme Court made it mandatory that every healthcare facility has to report their COVID-19 waste generation through this app, right? So when I say healthcare facility, I'm not essentially confining myself to only hospitals. Because if you go by the definition of the Clinical Establishment Act, then even the diagnostic centers or labs are also producing biomedical waste. And for that matter, COVID-19 biomedical waste. Okay.
Okay.
If you see the number, that we have 300,000 healthcare facilities in our country, and we don't know how many of them actually designated COVID treatment facilities. So my point is, according to the data that we have accessed from the Central Pollution Control Board, only about 3,000 healthcare facilities have reported this data. So the volume of COVID-19 waste, which is 45,000 tons, which have been reported, have come from.
No, but you're only talking about designated centers where biomedical waste is supposed to be dealt with. But Dr. Lata, our investigation shows these massive, unregulated dumps where COVID waste is piling up. People go, they buy it, they're reusing, recycling it. And this surely can't happen without local authorities knowing it's happening under their nose, and they seem to be looking away at this moment.
What you're saying is very true. I would say COVID has not broken the system of biomedical waste management. It has just revealed the broken system to us. When you're talking about piles and dumps of COVID waste in unscrupulous places, I would say it is not only contributed by the hospitals, but it is also contributed by lay people, because citizens are also using PPE. And there are no clear education or guidelines around disposal of these gloves and masks. So they are coming in large quantities, especially in the second wave. People are double masking, and this is coming in the market. So I would say COVID-19 related waste, not exactly coming from healthcare, but coming from lay common people, is also contributing to the amount of waste.
No, so now tell me, Dr. Lata, what is it that you believe needs to be done? Given that we can't allow for this medical waste to be recycled, repurposed and reused, how should we be trying to deal with this crisis?
Its pillar stands on two things: education, awareness, and penalty. Nothing. Enforcement has to be very, very strict. Like what you mentioned about the various clauses or sections under which you could put it as a criminal act, I think that has to come to be enforced. And it's not only COVID which has shown the volumes of waste getting pilferaged. It is there since beginning. It is just that, like I'm saying, now we are in a pandemic, and so we are able to realize the intensity of the situation. So education and awareness in all the healthcare officials. I as a practicing doctor, feel that there is a lot of lacunae in educating the healthcare about the importance of segregation and sending this waste to the right end destination. You know, I am really appalled that healthcare itself doesn't understand that while treating whatever you're creating waste can itself cause diseases. So education and enforcement, these are the only two ways where we can tackle this.
Sunil Pandey, your ideas on how law enforcement agencies and the government, particularly the health ministry, should be looking at this India Today investigation. What action do you expect them to take?
Strict monitoring and mapping. Like, for example, in every winter, Delhi and NCR looks for people who put waste on fire. Similar monitoring and tracking and strict penalty on defaulters would be required. Also, if anyone from the government officials seem connining with these people, a strict action should be taken against those officials as well, because this can lead to major catastrophe because of the very nature of COVID virus.
Finally, Atin Biswas, the fact that this biomedical dump could potentially prove to be a breeding ground for a fresh virus, a new virus or a mutation, explain why that threat is so real and present, and why this is a threat that simply cannot be ignored.
Yes, I mean, there is no denial that these dump sites or these heaps are absolutely dangerous, and we have to. I mean, there is absolutely no way we can compromise with the current situation, and we can let the system get away with this current scenario, right? So we have to come up with systems, and we have to, like Dr. Pandey also mentioned, we have to enforce strict monitoring and hold the people accounting. Why this COVID waste are being sold into the market, it is dangerous. It is definitely dangerous. And heaps are, I mean, our garbage heaps are already pollution hubs. So we have more than 3,000 of them in our country.
So added to this, added by this COVID waste, which is definitely dangerous. I mean, we have to do something to deal with it.
For the time being, Sunil Pandey, Dr. Lata Ghanshamnani and Atin Biswas for joining me on this broadcast to talk about this important investigation. Thank you very much. This is a powder keg, a sitting powder keg which can just go up at any point in time, because not just can it lead to a mutation of a new virus, it's also very dangerous if these syringes and PPE kits are being reused. The government needs to wake up, the local police needs to wake up, and we will see what action is taken after this India Today investigation. Joining us now on the Newstrack live and exclusive is the Principal Scientific Advisor to the Government of India, Professor K. Vijayaraghavan. Professor Vijayaraghavan, welcome to India Today. It's been a long time that we've been trying to set up this conversation. I'm glad that you could finally give us time. I want to start by asking you about the government's reading of the current COVID situation in our country. There was a time when the number of COVID cases was 4 lakh plus. It's now come down to around 40,000 a day. There is good news and bad. We're seeing some resistance in the falling graph of the R factor, the reproduction factor, but net cases are coming down. Within government, what's your reading of the current coronavirus state of play?
Thank you very much for having me here. As we've heard from both the Health Secretary and the Home Secretary recently, and from others, the falling of the number of cases is, of course, very good. But at the same time, they're very clearly warned that we are seeing the second wave still going on. And therefore, COVID-appropriate behavior is very, very important in every aspect. You mentioned 40,000 cases a day. That needs to come down a lot more. And that can come down only if we follow appropriate behavior, have masks, ventilations, and distancing. So there is a very strong message of caution which has come out from the government.
Some states like Kerala are contributing a bulk of the COVID cases, almost 30% of the current COVID cases coming from Kerala, which is where coronavirus started out in our country, as it was. So while in other states like Delhi, the graph has come down, in Kerala, it's still holding firm, and also now extending to the northeast, where the number of cases seems to be increasing rapidly. So A, on Kerala, why has Kerala not been able to get the better of the coronavirus? Is it also because they're testing more? And how concerned are you at this moment about what's happening in the northeast, Professor?
So, it's very, very important. And again, the Health Ministry has sent representatives to all these states to investigate the reasons for upticks. And fundamentally, you have upticks when the virus has opportunity to infect and transmit. And therefore, this is something which needs to be investigated about why you're saying this more. So there's more susceptible populations in these states. There is change in behavior which allows the virus to transmit. And maybe the situation there requires special attention in all these states to ensure that there's more COVID-appropriate behavior and management of cases until vaccination is substantially more complete.
I want to spend a moment talking about the reproduction rate, which is really what determines how fast the coronavirus spreads nationally. So there was a time when the reproduction rate had come down to 0.78 at the end of May, and it looked as if the situation was coming under control. It's now inched up to 0.88. So it's holding firm rather than continuing to go down. It's kind of gone up. If it hits 1, that's when the number of cases starts surging again and coronavirus starts spreading like wildfire. What's your current view of the rate of spread of the virus in our country?
So broadly, there are, two major causes of changes in the reproduction rate. One related to the virus and the other related to us. Related to the virus, we have the Delta variant, for example, that's increased transmission more than previous variants. And look at it this way. Supposing there's a secondary attack rate, meaning a person who's infected infects, let's say, 3 people. And now, let's say with the variant, that person now infects 4 people. It looks like a very small difference. But the result of this difference is after 10 rounds of such infections, you will have a few lakhs in the first instance and a few tens of lakhs in the other instance. So there's an enormous difference in the consequence of a slight change in the properties of the virus. Now, similarly, if we look at our behavior, if we don't allow this infection to take place, the new variant, by masks and distancing, we effectively balance out the increased transmission of the virus. That's in our hands. So what happens in terms of R, not in terms of how it changes, that depends both on the virus and on us. We cannot control the properties of the virus, but we can control our properties. So everything we do must be hinged on high-level, broad testing to make sure that where we see upticks of cases, we balance out and have more restrictions in place. And that's what the government has advised so that we reduce R below 1.
What is government data telling you about the variants which are of greatest concern to India at this moment? The Delta plus, what percentage of total cases currently are Delta plus? How many cases are being reported of the Lambda variant? Has it come to India? It started off in Peru. It's being called more dangerous than the Delta virus. So therefore, what can you tell our viewers about the current variants of the virus that are spreading through India?
I think fundamentally we must keep something in mind. And there is a matter of public health response, which is independent of the type of variants. And this is something we must really keep in mind. Otherwise, we seem to think that everything that happens is a consequence of the virus alone. Actually, most of what we need to do is independent of the variants. Right now, the Delta variant is a dominant variant. We know that while there is some amount of evasiveness and people who are vaccinated a single dose can get mild or moderate infections, that even protects against severe hospitalization, and 2 doses has a strong protection. Therefore, our principal goal right now is to focus on 2 things. Until vaccination is available, wear masks, have good ventilation, maintain distancing. It's tough. It's easy to say, but tough to do in each of our contexts, but we need to do that. And as vaccination rolls out more and more, we are better and better protected. So vaccination and non-pharmacological interventions such as masks and distancing are key, no matter what the variant is.
What about the speed of vaccination? Over the past 7 days, the actual vaccination on an average basis every day has been about 3.4 million. Till July the 10th, it was about 3.7, so it's come down a bit. We need to be at 8.8 million doses a day if the government's target for completing vaccination by the end of the year is to be completed. So there's a shortfall of about 5.1 million doses every day. That's more than double of what we're being able to put out in terms of vaccination on a daily basis. Why is the graph such an up and down, uneven graph? And why is there such a big gap between the government's supposed target and our actual delivery?
So the vaccination program involves multiple components, from making enough vaccine, manufacturing them, fill and finish, before that getting them tested so that they are ready to go, distributing, the states which receive them being ready to get them, and then the vaccination itself. Now you can see that when there are multiple steps, you will see ups and downs in them at these kinds of stages when you're trying to ramp up in a huge way. At the focus of everything which is done for vaccination is ensuring that what is delivered at the last mile to the last beneficiary is of quality. That's why you're seeing ups and downs over here. This will level out very rapidly. I would stay calm in this period of the next 10 days, 15 days, so that we see a leveling out at a high level of the vaccine supply as well as use over there. So a few days of down is okay, that can be compensated. I don't think we'll see a situation where it's low over a prolonged period. So that's not something to worry about. We must catch up on the last few days of lower vaccination, which I'm sure that we will.
This whole idea of mixing vaccines is being experimented with globally. There's been talk in countries like Germany and elsewhere, including Sweden, Canada, Spain, France, about mixing COVID vaccines. What's the current thinking in the government on whether, say, a Covaxin or a Covishield should be taken together? Does that increase efficacy, or any of the other vaccines, say a Sputnik and a Covaxin? Are you looking at that? What's your data telling you?
So the government research agencies and also internationally, there are trials going on to see that these kinds of mixing, A, don't cause any problem, and B, are more effective than not doing so. And so that's something which we'll have to wait and see what will happen. But fundamentally, we must keep in mind that no matter what the vaccine is, they elicit an immune response to the spike protein or to a component of the spike protein. And therefore, having one vaccine doing that and another vaccine enhancing it is scientifically not something which is a problem. In practice, though, whether this is efficacious or not is something to be tested out, and that's what is being done in multiple locations. And once that is done, our national regulatory bodies will take it.
There is talk that soon in India, vaccines will be available for kids above the age of 12. Will that be something the government gives official sanction to? Because a lot of parents very concerned about their children and about when kids will get vaccinated, sir.
So that is something which again requires proper decisions from a medical as well as a vaccine efficacy point of view, and in terms of the effects on children. And all things point to a direction where this is feasible. Now, in terms of what is there in the program right now, our principal goal is to vaccinate all eligible people above 18. That will be substantial and essentially sufficient to curb the transmission of the virus. That will leave people below 18 as unvaccinated. And as vaccination rolls out to completion in the above 18 group, simultaneously we must look at this other group, because those will be the unvaccinated group which will be present at that time. Again, that's a matter which, as trials go on nationally and internationally, we'll be able to take a call very soon over the next.
How far are you from taking that decision for allowing children above the age of 12 to get a vaccine?
That is exactly the kind of decision, but needs to be seen in two contexts. Again, national and global trials to look at that. And secondly, how that needs to be balanced in terms of the large 18-plus group whose vaccination is a primary goal.
The biggest fear at this moment is the ghost or the fear of a third wave. On the basis of all that you know, what's your sense of when this third wave may hit India and what form and nature may it take?
The very simple matter, whether it's the first wave or second or whatever, is viruses will spread if there is opportunity. Now, the opportunity can come when there's a large naive population, as was there in the first wave. After that, many people were infected, and that immunity lasted or is lasting for some time. Similarly, after a second wave of a rather substantial surge, you will find people who have been infected, and there are also the major vaccination program going on. So in terms of opportunities to the virus, there will be steadily declining opportunities as more and more people are vaccinated. If the rate of vaccination is such that the number of people available is very small, then further infections will affect those unvaccinated people, and they will be very, very small. Now, what is the likelihood of this being bypassed by a completely new variant? That's, in terms of what we've learned from variants such as Delta and other variants, vaccines which have been made now, even if these variants modestly escape the vaccination to some extent, they protect hugely against severe disease or hospitalization. Now, when a whole population is vaccinated, the virus presence also goes down substantially. So you're going to have very little virus transmissibility in the population, and therefore the protection will be much, much better. All these mitigate against the consequences of a third wave. If we slow down on any of these things, we afford greater opportunity. So we need to see how we're doing week by week, month by month, to see how much opportunities will be. And also, it's very important to keep in mind the global situation is going to be critical. India is not an island. What's happening now in countries in Africa, in Indonesia, in South America is very, very important. These kinds of spreads which we're seeing there, the surges which we're seeing there, similar to the surges we saw here during our second wave, are also potential grounds for completely new kinds of variants coming. Therefore, there and here, large-scale genomic surveillance, which has been scaled up, is very important to watch out and prevent those variants from actually spreading and detecting them as early as possible.
The India Today Special Investigation Team carried out an expose which shows how biomedical waste is this huge hazard, because we've got on camera these operators who are buying syringes, PPE kits, medical waste, cleaning it up, reusing it and pumping it back into the market. And from what I've been reading internationally, it seems that this is a huge area of concern when it comes to a possible area where a mutation can take place which can lead to a deadlier variant. How concerned are you about this? What do you intend to do to try and stop this, sir?
So the improper disposal of biomedical waste and the completely wrong reuse of it is a very serious crime according to our rules and our laws. And therefore, it is completely incorrect where this is being done and where it's being done, and will draw very strong penalties. So whoever sees this happening should bring this to the notice of local authorities immediately. And I'm sure and I hope that every single city and state authority will take the strongest possible action. This is not only a danger in terms of new variants, that's actually a separate discussion. But in general, in terms of infections of very serious kinds, other kinds of infection, reuse of biomedical equipment is very, very incorrect, wrong, and illegal. And that's something which is just not wrong.
Lastly, huge concern at this moment about events like the Kawad Yatra. We saw the Kumbh in Uttarakhand lead to a huge concern about spreading the virus nationally. Now the Uttar Pradesh government urging the Uttarakhand government to allow the Kawad Yatra to take place. As someone in government, how concerned are you that these religious, political events could cause problems for India's fight against the coronavirus nationally?
Again, it boils down to a very simple answer. Difficult to see it implemented, sadly. Simple answer is the more opportunity you give to the virus, the more there are potential dangers, right? And therefore, any crowding, particularly in closed spaces, is dangerous. Prolonged contact, even in outdoors of great proximity, is also not good. And this is just, asking for a situation of greater transmission. I hope that this message, which has been repeatedly told to various, to all of us as citizens, to state governments, to cities, results in COVID-appropriate behavior. Otherwise, we seem to forget too rapidly what has happened recently, and we need to make sure that this doesn't happen again.
I leave it over there, Professor Vijay Raghavan, for taking out time in a very busy schedule. Thank you very much. Your insights are much appreciated.